Before we talked a little bit about, well, how do we build a team? We're going to have a physical expert and we're going to have a psychological expert. This may be as straightforward as a family doctor, a physiatrist, and a psychiatrist. So here we have the medically driven. These are the folks that we're going to be looking to say, in your professional opinion, what do you believe is happening right now? What's going on? And then from there, we're going to ask them, what should we do next? From that place, we're going to have a number of paramedical experts come in. These are your physio, chiro, massage, kinesiology, counselors, folks like us that are receiving direction from the medical folks. They're directing us. We then are working on an evidence-based model. So we do conduct assessments, but probably the most important measure is the one that is reported from the individual who is actually experiencing it. So yes, we may go through and conduct assessments on various types of function. That's standard. However, we're looking at it also from the point of view of the person saying, how are you doing? And if they come back with, I'm sleeping much better and I feel better because now I'm sleeping. Well, that type of evidence-based approach is then going to be fed back to the medical doctors. This person is not sleeping. They're staying up all night ruminating. Their thoughts are going through their head a lot. They really can't seem to calm down. A lot of anxiety, a lot of stress. Everything's unmanaged. Okay, go ahead and define that medically. Put that together into what you would believe would be your assessment and diagnosis. You tell us what's going on. Then pass it over to us and we'll collaborate on what are we going to do about this together. We then empower the individual to follow some very clear, very well understood protocols of how we're going to approach this based on evidence, based on good clinical practice, and constant feedback between the doctor and the other care providers and the client or patient. Really important to ensure that they're involved in every aspect of their care. So this is a little bit about how that model works when it starts off medically driven and then it's evidence-based. It's incredibly important to know as well that if you've been in a motor vehicle accident, there are certain rules that must be followed. And that probably deserves its own separate topic altogether. But I can tell you that a medically driven and evidence-based model is compatible with the legal process involved in a motor vehicle accident.